Functional problems with our patients is something that we're very concerned about in this practice, and we get asked a lot, is it possible to be grinding your teeth and actually losing tooth structure without knowing about it? And it absolutely is. The issue with grinding is that for people that brux, and bruxism by definition is just kind of the gnashing of teeth, this parafunctional type movement, sliding back and forth, using your teeth with something other than just chewing. And it typically happens when we're sleeping, and we have the ability to put enormous forces on our dentition and our teeth at nighttime. The thing to be concerned about is that once you wear through the outer layer of your tooth structure, the enamel, and you get into the softer dentin, the wear is now 7 times faster. So sometimes we erroneously conclude, if you're 45 years old, that you lost, say, 2 millimeters of tooth structure the first 45 years of your life. You're only going to lose 2 more millimeters. And that's not true, because once you get there, the wear and the damage can accelerate much quicker. So the thing that we have to do with this type of situation is to always begin with a thorough exam and have a look, because the thing about bruxing and wear is that the longer you wait to deal with the problem, often the more expensive the solution and the greater amount of dentistry you're going to need. The most complicated cases that I see are patients that have waited until their teeth are almost down to the gum line, and it becomes a horrendous problem to try to fix that. So the earlier we can detect it, and the more we can provide you with protection and maybe analyze your bite to see if there's things we can do to help you, is an important part of this process. But let's just take a second and look at our Guru software, our patient education software, and just describe what's going on with this, and look at 2 different ways you could be losing tooth structure, and then the things that we can do to maybe prevent this from getting worse. So let's have a look. So the first thing we want to look at with bruxism is the understanding, and we'll just separate, keep your eye on this over here. This is the normal, and as time goes by, with bruxism, patients are sliding their jaw back and forth, or they can be sliding their jaw forward and back. The bottom line is, the more we grind with intensity, you can actually be losing height on your teeth. Again, about here, when you start getting into the softer part of the tooth structure, is when damage can really accelerate. So as you look at yourself, if you're starting to lose some of the natural little curves in your teeth, it's a good indication that this is happening. And believe me, this has nothing to do with what you're eating. This is something you're doing either at sleep or during the day. And one of the most conservative things that we can do to prevent this is just make you an appliance, a night guard that would go over your teeth and just protect it. So if you're sliding around, you're going to wear the night guard out before you would wear out your natural dentition, which I think is the most important thing. And from a diagnostic perspective, we'll be able to look at the night guard and to tell whether you're continuing to do it. Additionally, sometimes we can adjust your bite or do some restorative procedures to improve your bite, to create a mechanical disadvantage so you can't do as much damage. But that's something that we would determine with a full diagnostic workup when you come to the practice. The other thing we occasionally see is that people that grind and brux, that you may end up with a very localized type scenario, where you're not losing the tooth structure down, but you're actually putting a lot of pressure this way that causes the tooth to bend, where you'll lose tooth structure at the gum line. And so what happens over time is you get sort of a micro breakdown of the tooth structure right at the gum line, and you end up with what we call these little abfraction lesions, and you can feel them as little cuts in your teeth. We for a long time thought this was toothbrush that's doing this. There is some research that say toothpaste abuse, too much of an abrasive toothpaste can do this. But there's also no question that bite-related issues causing the tooth to bend by putting too much force can also create that problem. And so we would again look at a solution either with a night guard or doing things to your bite to lessen the lateral damaging forces on the tooth. So the most important thing is that tooth wear is one of the most undiagnosed dental problems in dentistry. I spend a lot of my time in this practice looking at solutions for patients who are wearing their teeth down. And I think that as we move forward with the baby boomer generation getting older, it's going to be the most prevalent thing that we're dealing with. Why? Because people are keeping their teeth longer than ever before. We're doing a good job with the biological aspects of dental disease, and this is sort of the last weak link in the system. So with that, make sure that your dental professional is keeping an eye on that. Wear is not normal, and if you have any further concerns about this, we're happy to see you at our office and have a consultation to see what we could do to improve your situation.